So this is our last breakout session. I'm Amy Shea Reyes, she, her pronouns. I'm the Behavioral Health Manager for Children, Youth, and Families with CareOregon. I'm very, very, very pleased to introduce our next two presenters who will be talking to you about culturally specific care and considerations with youth, or for youth with substance use disorder. From LifeWorks Northwest, I'd like to introduce Tesfaye Denbi and Archie Moore.
Thank you, Amy. Amy used to be my supervisor before she moved to CareOregon. Before we go ahead with the presentation, I would like to acknowledge that we are located in Multnomah County. It is stolen from the indigenous people along the Columbia River, many tribes, Tualatin, Clackamas, Multnomah, and many other indigenous nations. So we just want to acknowledge where we are, the space that we are present. So we just want to see their spirit to guide us today as well. Before we go ahead with this presentation, I would like to briefly say about myself as well. Currently, I am a clinical supervisor at LifeWorks Northwest, doing a dual diagnosis, co-occurring treatment service for youth, both substance use and mental health, close to 10 years. Prior to that, I came from South Africa. I was trained as a clinical psychologist there, done some clinical work as well as research. Prior to that, I came from Ethiopia, did also some work back in Africa. So when I speak today, it's also based on my experience from here in the state as well as back home in Africa, where my roots are. I'm going to pass the mic to Archie as well to say briefly about himself.
Good afternoon. We're coming to the end here. So we're going to try to get us to the finish line and keep you awake. And I'll try to do some crowd participation. I got the little hanky because I'm not feeling that well, but I don't have COVID. I've been tested, I promise. But it kind of hurts me to talk. That's my excuse. Got that out the way, Amy. But Amy was my boss as well, but we work at two different agencies for LifeWorks. I work for Project Network, which is a women's facility for children, and we're located at 3655 Northeast Garfield. So I mainly work with women and children. I've worked with all sorts. I worked with, you see, FCP. I'm a family care provider. Started with DePaul treatment back in 1900. No. That's when you know you're old, when you. But the age part is like what we want to talk about today too, because I'm happy to make 55. Because where I'm from in Illinois, I didn't even really think I was going to make it this far, so I'm blessed. And so I did, like I said, started off with I got a counselor and training position at DePaul, and I started doing foster care with kids in the juvenile system. And then a few years after that, I went to LifeWorks, worked through a lot of different programs at LifeWorks. Nickerson, I don't know if you heard. I worked at the Real program when it was called Lay Naleo. I don't know if you heard that, but and then I worked there for several years. Started my own nonprofit. Did that for 6 years, and then did my internship at Project Network, and that's how I ended up back. So I kind of did my whole spiel backwards. I started off with the work, got paid for it, and at the end, I got my internship. I thought it was pretty brilliant myself, but yeah, that's me in a nutshell. Now I'm back. I took a break from foster care. Now I'm back doing it, and I wanted to do younger kids, but they talked me into doing the juvenile kids again, because that's where a lot of my expertise lays at. So I'm back as a family care provider again. So thank you.
It has been a pleasure working with Archie. He knows historically what has been going on in the community as well. When we do this work, it's not necessarily related to a substance use issue. It might be a displacement. Folks has been pushed out of the neighborhood they have been living. So he has rich historical experience living in Portland, experience how that has been also impacting our community. Archie and myself don't have any financial disclosure. We don't have any relationship with any commercial interest regard to this presentation as well. We do have around 3 learning objectives. The first one is to identify at least 2 clinical benefits of using culturally focused intervention, especially with the use. And also, what are the important considerations regard to substance use disorder treatment. And finally, we are also talking about what are important culturally responsive use engagement approach. And this will help us to engage youth from a different cultural perspective. I know currently we lean heavily on medical model, Western treatment approach that might not be fit to other ethical group. So this is why we need to decolonize the behavioral health and substance use treatment field in particular, to find what are other treatment approaches that might be good and culturally relevant to this population group, especially for youth between the age of 12 to 18, where identity development is emerging. So I hope this presentation will spark you, make you to contemplate what are the other culturally relevant treatment approach other than one size fits all that you can consider, and if possible to unlearn some of the things that you have learned from your institutions that didn't consider different ethnic and cultural consideration when we provide treatment, when we engage youth. So beyond these 3 objectives, I hope this presentation will get you to that space. We currently just get data from CareOregon. Before we get to that, there was a statewide research and survey conducted by OHSU, PSU School of Public Health, many others, Oregon Alcohol and Drug Policy Commission, and they found out that in terms of their service inventory and gap analysis, regard to equity and access, there is insufficient provision of culturally responsive treatment services. And also the workforce that doesn't represent the demographic of the state. This is where, this is a 2023 gap analysis and service inventory that really clearly laid out in terms of, yes, there is a lack of culturally responsive services. As you all know, currently here in the Portland metro area, we have only one residential program, that is NARA, providing this level of care, especially residential level of care. We can look the room around here too, in terms of, we focused here serving youth. How many folks are here providing that kind of culturally responsive service? I just want to see hand. I saw only 2 hands right here. I would like to hear what kind of culturally responsive service you do.
It's an opioid treatment program run by the CareOregon tribe, incorporating holistic values.
Thank you.
I work at Reynolds Middle School, providing culturally responsive mental health therapy.
Great. Thank you. We are in Portland metro area, where we will find in the whole state more diverse folks and diverse people, but we still see only 2 folks raising their hand. And this makes you to ask the question, what kind of space we are? What are our college and institutions are producing? Why are we not pushing into recruiting more culturally diverse folks to get into this field? So this needs a lot of restructuring, needs a lot of work. And luckily enough, we were able to receive data from CareOregon. This is the number of youths between the age of 11 to 18 who access residential level of care. As you see, the one with the green, that is Caucasian and followed by Hispanic, and the sky blue is for Black. The number gets to 1 digit when we get to other different ethnic groups. Again, when you compare to the total number of youths who are enrolled in CareOregon between 2021 to 2023, it's about 60-something thousand. Out of all that population group, we have only this number of youths who are entering to residential level of care. This makes you to ask again why we have low utilization of substance use treatment service. Luckily again here, we also received the data from CareOregon that clearly lays out about these are the youths who are enrolled in outpatient substance use treatment between the age of 11 to 18. Again, when you compare this number with the total number of youths who are enrolled with CareOregon or HealthShare, which is about 60-something thousand, while we're having a low level of utilization of care and treatment for youths, especially with different cultural group. So this brings you to the point that earlier the panelists talked about, this is a state that we depend heavily on corrections and the juvenile department rather than the health department. So it is important that we consider what kind of other tools, what kind of other treatment modality do we have to really tap into to broaden our treatment approach, especially for youth with substance use treatment. With that note, Archie is gonna give us a little bit of background about what is cultural responsive treatment. What are the core elements when it comes to cultural responsive treatment? Sometimes when we talk cultural responsive treatment, even if we are working in an agency that is based on a dominant model, how can we make it culturally relevant to the people working to us? So he will be giving us a breakdown around what is the core element, what are the core elements of cultural responsive treatment. Before we go ahead, if you please have any question, any idea or any point that you want to make, this is not a one way of communication. So feel free to raise your hand, say something, ask question, so you're welcome.
So cultural responsive care is defined as intentional and consistent decision health care. Basically, it means us as professionals need to be more mindful, and I heard many a times today about individually based, and sometimes the black and brown kids, they have more disadvantage as the average kids. And that's a whole nother conversation that we're not gonna have today, but us just being mindful and understanding and being aware of our differences as well. And that's what that basically breaks down to. It is a philosophy that guides providers towards fully seeing and valuing clients for all aspects of their identity, culture, background, and experience. Anyone wanna add to that? Anyone? No. Want to have crowd participation if nobody gets involved here. Well, last night I sat and I said I'm just going to circle a few that I wanted to talk about, but it's almost impossible. Probably all of that applies. Most counselors would put this information in the presenting problems, right, in dimension 1. People get mixed up the ethnicity and race all the time. What is the difference? What do you think the difference is? Anybody?
Okay. Ethnicity pertains to geography, what country you might have been born in or raised in, whereas your race is I don't want to say biological, but like
the physical and social aspects. Right.
Yes.
Right. You're exactly right. The ethnicity is more the cultural. It could be the religion or language or something like that, versus the age is, like I said, the physical, like black, brown, white, etc. These are all important components when working with kids. The military service may not apply in this day of age, but like I said, the age, when I was making a joke about my age, some people, like maybe from Chicago, that may not have a lot of hope or kind of reckless. That age part is important to talk about. Where are you going back home to geographically? What is your environment inside the house? So these are all important components when you're interacting or assessing or interviewing a teenage child of any race. That's important for adults also. But I have an example of a young man I worked with through the outpatient program. He pulled me to the side. He was like, hey, he's a single parent, and he is struggling. He was like, Mr. Arch, I'm struggling every time I walk home. You know, they're smoking weed and drinking, and I get tempted all the time. So he did relapse a couple times, but last time he had some longer clean time. Last time I spoke to him, it was over a year he was clean, because we talked about he couldn't just pack up and leave, but we talked about some strategies to get through that. Instead of just walking straight through the fire, let's do something different. And I don't recall what the strategy was, but it was not walking right through that neighborhood. So that the environment, the geography in that case was really important. In the black community, in the brown community, spirituality and religion, most of us know that's two different things. So the religion part, that structured unit really plays a big part with African American and brown folks. But now, it's becoming more open with therapy and stuff like that. We would depend on the praising God. I heard the preacher say one day, if a guy's standing on the corner and he gets shot, you're not going to pray to God, you're going to go to the hospital, right? You're not going to stand there and pray to God, you're going to go get some help. And it's the same thing with your trauma. You got to go get some help. You can't just hold it all in. And that goes to I think it's in another slide where we talk about the historical trauma of people of color. And that piece is important because a lot of that history was taken away, so that's why we got to address that part. Does that make sense? I know y'all probably heard some of this before, but does anyone want to touch on any of these characteristics? Okay. Core elements of competence. Culturally responsive practice reinforces the counselor's need for self-exploration of cultural identity and awareness, and the importance of acquiring knowledge and skills to meet clients' specific cultural needs. Another reason why those competence and the cultural identity is important. Let's see. Like certain countries, like what is it? In Malaysia, it's rude to point at a person. They point with their thumbs. That seems odd to a lot of us in America, but that's what they do. Some people will point with their lips, and I forget what country. Some people, like in France, they'll greet you with a kiss. Right? That might be odd to some of us. Some of the people in, I think, Malaysia, the women will greet you with a kneeling down. And some of the men will greet you with prostrate, not prostate, but prostrate, which means you lay down flat on your stomach, and that's how they greet people. And they said that was a lot of work to do, so they kind of minimized the times they do it. But in Japan, and I think Malaysia, I might have got something twisted up, but their eye contact, it's important to know that part because they think it's like disrespectful to stare for a prolonged time. So I teach healthy communication at Project Network, and sometimes I role play, and I tell people to have good eye contact. So if you have a person from another country that their values and belief system is different, you're going to have to understand and know that and be aware of that. And if you have any counter-transference, talk to you, get some supervision and talk through it, whatever your differences are. So the cultural competence involves counselors' willingness to explore their own histories of prejudice, cultural stereotyping, and discrimination. Now, I told you earlier I worked for DePaul. One of my first, when I was green, I was interacting with my first client. He had excuse me if I don't pronounce this right, he had a swastika on his arm. So, did I pronounce that right? And I immediately got kind of standoffish on that, of course. And I talked to my supervisor. I said, "This is not going to work. This guy is racist, and I don't want to deal with him." But long story short, it's about building those relationships. And my supervisor taught me that a long time ago. We had to build relationships. His SWAT sticker was from the penitentiary. So he was trying to get in where he fit in to survive, because he was actually a sweet guy. And once I got to know him, and then he ended up completing. It's hard to keep track of where the clients go, but we ended up building a nice, healthy relationship, with that in mind, and that's with our teenage kids. We definitely, no matter what color they are, we have to build those same relationships and identify our differences. So, any questions or comments? Okay. So I'll turn it back over.
Thank you, Archie. Just to add regard to the historical as well as generational trauma, it is so important to look into what is my blind spot. What are my directly or indirectly that have been impacted by either by institution or by individuals. Counselors who know their history, they are more likely to study about the history of their client as well. So investing in yourself first as a counselor, knowing who you are, what are your privilege, what are your blind spots. When you sit down with someone in front of you from a different cultural background, rather than labeling it as a resistance, rather than labeling it as a pathology, it will give you a chance, a space to learn more about where I am coming from. What are my privilege? What are some of the things that are factual but are based on my experience that I'm seeing it, viewing it differently? War on drug that has been historically impacting and is putting a lot of people into incarceration caused a lot of damage to the youth that we work today. If I'm not aware of that his grandpa has been serving 10 years, just minor in possession, I'm quick to judge about, I have to approach it from a different lens. I don't know how to approach this kind of youth. So it is so important that Archie mentioned about what are some of important core elements of cultural connection that we have to establish as a counselor. A doctor goes to see a kid, they have an instrument, they listen to their heartbeat, they do those kind of decisions. It is so important to get this into my own cultural lens. Institutional history that has been causing a lot of harm. So this is so important, so crucial that we invest time to know the culture of our client that we serve beyond the time that they come to the session. So that is the just point I would like to make. And also to know the history of the people that we serve as well. I know a lot of textbook and people talk about starting from 1619 only. If you look the people of African people prior to 1690, they were kings and queens. They built a lot of institutions. One of the places I would like to visit in Africa is in Timbuktu, Mali. That's the ancient library you can ever see. When you experience that kind of knowledge, that kind of rich cultural experience, make you ask to yourself, what kind of damage have you done? What are we continuing to do? So history is being made right now today as well. So what kind of history are we making at this moment? I'm not usually angry with the judge who make a decision about a kid going to a correction facility for 10 years or now. Before the judge make that decision, a teacher from the classroom, when they were in middle school, done some harm there. So it is always important and good to consider those kind of cultural markers. We talk about school to prison pipeline. Currently, the data is suggesting us to look into birth to prison pipeline. So what are those markers that you see in the middle school and the pre-K? When a kid acts naturally, we're labeled to sit down. Got labeled in a certain way. That paperwork followed them later on in their life. So as a counselor, when you see a paper written by either a school counselor, school social worker, it's always when you have a different lens and perspective about the use, the culture, then that makes you to see from a different lens. So it is so important what Archie mentioned about to look into a core cultural competence. That makes a huge difference. And these are some of the benefit of cultural responsive care. And my friend usually says, culture is medicine. And therapy doesn't happen only in 1 hour session when we sit down with the youth. It's always to involve cultures, rituals, ceremony that embrace the client who are sitting in front of us. And these are some of the benefit of cultural responsive services. Anyone who'd like to add any other benefit of using cultural responsive service here?
I guess we're always talking about like building up the natural supports, right? Like the people who are in the teenagers' lives are the ones that are going to be able to do the most, you know? Like I'm going to see them for an hour a week and then I'll see you next week, right? And so it seems like I'm thinking about like that supports the belief that culture is essential to healing because the people who are in that kid's lives share those culture, right? Share the culture that the kid is, and that's how you engage the whole system that's around the kid, right? The family, the grandparents, the church, the neighborhood. And that if we're just looking at like not engaging with culture, we're gonna miss out on all of those natural supports for healing.
Perfect, thank you.
I don't think I'm adding to this list, but I'm thinking about the conversation earlier that we had about incentive versus motivation with the panelists, and I'm thinking that with culturally responsive care, we can get a better sense of like, so in my mind when we were having that conversation earlier, incentive is what can I do to bring kids in the door to start that first step versus motivation, what comes from the client and their family to sustain that change and go all the way to step number 12 or et cetera. You see, learning growth. But anyways, so culturally responsive care will help us better understand each parts of those factors that move us towards the outcomes that we all hope to see.
Thank you.
I think kind of piggybacking on what you said, it also helps us to communicate with those safe adults in a young person's life and destigmatize where some treatment, behavioral health things are stigmatized in cultures, to be able to communicate in a culturally responsive way so that we can remove those stigmas in all cultures so that we can work together.
Perfect. Okay. Archie just asked a question. Okay.
Sorry, I just wanted to add on. I think that these moments help heal generational trauma between different identity groups for them to come like eye to eye and slowly build it.
Correct.
Yeah, no, I was asking, can we take a look at that? What are some of those things that can get in our way when we're trying to deliver those services to like a teenage African-American kid? What are some of those things that can get in the way of his services? Has anyone ever thought about that? Can we just talk, whether it's uncomfortable or not, what are some things can we talk about that today? Yeah.
Thank you. Yeah, I actually wanted to ask, one of the things I personally struggle with is my whiteness, my sexual orientation. I walk in as a white Christian male, and in my mind, I start to want to look for commonalities with my client, and I think there's a time and a place for that, but I also want to come with it curiosity. And I guess if you have any suggestions for a white guy, like how from that first handshake, how can I help to break down those maybe the barriers, but also perceived barriers, that I do have lived experience and I do have a heart and compassion for that other person.
Thank you. Archie, you want to say something?
I really appreciate you asking that, because that's a good and that's honest, and I appreciate you saying that. I think just like I said at the beginning, just being yourself and just building that relationship, play a video game with that kid, or see what he likes, he or she likes, and just ask questions. And some of them will be closed, but the more that you interact with them, they'll start to open up. I have the foster kid I'm working with now. I had him a couple weeks now, and he was closed. I know I'm not a white guy, but this is just an example. But I had to keep talking to him. I had to ask questions, and he's not totally open, but he's beginning to. And teenagers are like that. I know I'm getting old, but I remember when I was a teenager, I was like that too. Anyone else? What are some things that got in your way?
Well, I was just going to answer your question, or just kind of expound. Just expound upon what you were saying. Like, if we're just coming from a completely different place, and say I don't really understand or know much about your spirituality and your religion and how your spiritual community works, or how your family works together in community. I mean, if I'm used to like a core family of like a mother, father, and kids, and a family that I'm working with, they may come all together in community, and the grandparents may be very much taking on the role of parent in some of it, and the aunts and the uncles are all, it's more community based. I'm just coming from a different place and a different space, and I don't know what it's like.
Learning that, yeah, that's a good point. And let's continue to learn that about those different individuals. What I remember when the real program was Lay in the Leo, one thing that we used to do with the kids, and they're all individual kids, but they're all African American kids in the system. We would have every month, did you guys still do like a potluck with the family, not just with the kids, but with the families, the auntie, the mom, everyone's invited, and we sit down. And I hope I'm not stealing this from you. I know he shared this with me, but I experienced it. Some of them would say, some of the family members say, this is the first time I sat down and ate with Jerome or whatever his name is, And so just having those kind of connections helps you build that relationship. I know that's a little off what you said, but you kind of triggered my memory of, that works, Some cultures may be a little different, but sitting down bonding, that kind of helped to break ice with the families that couldn't do nothing with Jerome. So.
I think one of the big barriers is fear of bringing up differences in the room. When I work with a client who looks and thinks differently than me, it's important to name those differences and be willing and able to talk about them in a way that's meaningful.
Mm-hmm. Good point. Because what do I have in common? I'm sure I have something in common with the women I work with, but most of those women's background is domestic violence. I'm a man, so I had to work through kind of like what you're saying, and so I'm interacting with their children, which the children probably had some trauma too, and so yeah. So thank you for bringing that up. That is important. It goes back to those relationships. So now a lot of the women like, where's Mr. Archie at? Because I built relationships with them. I sit down and talk with them. I don't just sit in the office, So I remember when our director, when I first came to Project Network, back in the days I used to do gambling groups when they were on Mississippi, and she was like, Archie, you're here? And she looked confused. Like, yeah, I'm here. But so it's kind of funny looking back at it. But now she looks at me and she says, "Oh, you're doing a great job." So.
Hi. I think that especially in our field, and if we look around, like the social work and counseling field tends to be predominantly white women providers, and that there's a long racist stereotype that black men are dangerous to white women. And so if I am a provider that doesn't recognize that I hold that bias, and I have my black teenage boy client and my white teenage boy client, and they both pop off maybe in similar ways, I might be more accepting of that from the white client and more scared or frightened from the black client if I don't recognize that I have that belief. And I think that white women in particular, like that's really a conversation that we need to be having, because we think a lot about like what do they bring into us, but I think that as providers we sometimes have a hard time thinking about what are we bringing in. I know that I have made several missteps before, particularly about class for me, but I'm a very middle class person, and that is a place where I have made missteps that I've had to come back and correct and look at quite a bit too.
Good. As professionals, we got to keep growing and don't be afraid to admit where we're lacking at. Yeah. Real quick, go ahead. I'm sorry.
I think as providers too that it's important to be curious, but it's equally important to understand that it is not always on our clients to educate us. It's on us to do our own research and find our own education and not put the burden back on oppressed populations.
Good point.
I just wanted to go back to the speaking about barriers piece, and I work in a health center setting, and when we screen in, particularly I've noticed with males, when we talk about talking to a professional and talking to someone about the stressors that they disclosed, they default to I talked to my girlfriend, and how much that's a gender dynamic that comes out a lot, and it begins so young, and just how much that pans out in research as they get older too, is that most spouses say that my significant other is the one I talk to for males, but women will predominantly say, I have my coworkers, I have my friends, I have other sources of support. And so that's something it's come up quite a bit. And I say, your girlfriend's not responsible for your mental health. We have professionals that can help you. But it is this just default, I talk to them. And so it's just very interesting.
Thanks for sharing that. In the back.
It's good.
Thinking also about barriers, I feel like Tesfaye, what you were talking about is so important about the way that we have social interactions and greet each other. And I think about when I went to meet my husband's family in Mexico, and he was like, you need to go up to every single person and you have to hug them and you have to say hello. And that is not what I would do with my family, but that was what was culturally expected. And if I hadn't had him to educate me, then I could have potentially had a really bad first impression. And I think that we need to be thinking through that, especially as we're meeting clients with different cultural backgrounds. Do I call you by your first name? Do I call you by Mrs. your last name? In order to, be respectful, we have to do a bit of that extra work. And I really appreciate the person who said, it's not on our clients to educate us. And also, if we don't have friends or folks in the community who can help us with that education, and thinking about how segregated Portland is, I guess I wonder, what do folks do in order to, really be thoughtful and address that barrier?
Good, thank you. A lot of important stuff. Thanks for saying that earlier too. For us to educate ourselves and not depend on our clients to do that. Because we have to be aware of the transference the counter-transference that we have and the transference, and just talk about that stuff and get through it and educate ourselves, and not depend on like the young lady said over there, not depend on our clients to do so.
I was like, can I borrow? Make me laugh and I'll forget what I was going to say. I think the other piece of it too, though, is just to say, like, if I've done my own learning about a culture, not to assume that that's the way that person practices that culture. And so I think also just back to what you said of, it's good just to ask, you know, and ask questions and be really open and name differences too.
Yeah, good. If I had another, I have a lot of different experience. When I was working at DePaul, had a young lady, and if I knew what I knew now, I would have came about it differently. She used to always cuss at me and get mad at me, and I like, what's going on with this woman? I got in my feelings. And I'm like, what's going on? Eventually, later on, they found out in group that I reminded her of a pimp. So that's a whole nother culture over there. I triggered her, and you know, I should have addressed it, like asked her questions. Is there something about me that's bothering you? Or do I remind you of somebody? And that would have been, you know, but I was dependent on her to work it out, you know, and I was the professional, a very green professional at that time. So. Yeah.
Hi. One of the ways that I was thinking about I guess an intervention to be more culturally responsive is it's kind of like I have two ideas, two thoughts. Obviously, as a social worker, I love that Venn diagram that shows all the different layers of identity, right? And I think some of our teenagers or youth might be able to process each of those different factors if we presented it to them as a mandala exercise, where you kind of say like, okay, how much does this part of your experience matter to you? How much does this part matter to you? And another way, if you just need to process verbally, one of the things that I ask my clients is like, what is most important for me to know about you? Obviously, that's a big question to present somebody. And it's something that comes over time as you build the relationship, where they're going to share more about the different aspects of their culture that are important. But I guess at the end of the day, being culturally responsive is really the only way to build the genuine relationship and not the rapport. Rapport is important, but like we're all in this profession because we genuinely care for people, so we need to genuinely show up in our professional roles for them and in our relationships with them.
Good point. Thank you for sharing that. So I'm going to turn it back over. If there's no more comments or questions, I'm going to turn over to Tess, and I think he's going to talk about like some of the rituals, African rituals and cultural beliefs, right?
Thank you all. Just to add a piece as well here in terms of when you provide cultural responsive service, you're not addressing only substance use issues. It will give you a room to consider other social determinants of health. So that's why it's so crucial that you include a cultural piece and social piece that comes in the way of you providing substance use treatment. If I may give one example, for instance, a youth who was in the program right here, in the A&E program, they're here too, folks who work closely with them. They referred, this is a kid from Somalia, and he was gotten a chance to get home to visit his family, he got a pass from a residential program. We were talking during session, and ask him, hey, you're gonna go out. When you come back, if you turn positive, it's gonna cause some issues. So how are we gonna increase relapse prevention strategy? You know, I didn't come up with a relapse prevention skill. I asked him. It's always good to ask in terms of whatever you think would help them, they will tell you. So you strategize based on, strengths-based, based on from the youth perspective. He mentioned this, if I hang out with my friends so and so and so, when I get out, definitely I'm gonna use. But my family goes to prayer on Friday. Culturally, that's a Juma. So that is a time I would like to go out. So I'll spend more time with family, not with the other folks that I was caught up in the situation to get into that kind of space. So it will give you a lot of resource and tool for you to work with. You know, coming with your own perspective, your idea, paperwork and homework, giving them. They are giving you the tools right there. So you use that kind of something that comes naturally to them. They are involved in crafting, informing their treatment plan, their everything. So this is so crucial that you tap into that kind of world to really form a more culturally sensitive and treatment approach and make that this is progress. They see it, they own it. Then it will also decrease your anxiety in terms of how you operate in the whole treatment plan approach. I know we're running out of time, so I'm not gonna spend a lot of time here. I'm gonna quickly talk about, there are different kind of culturally responsive treatment approach, include, for instance, storytelling, rites of passage, and culturally responsive multidimensional family therapy approach. And we briefly will talk about the REAL program. REAL stands for Recovery, Empowerment, Achievement in Life. As I mentioned earlier, as well as Archie, we work with youth between the age of 12 to 18. REAL was created out of the idea that youth with substance use challenge, mental health issue, gang impacted, as well as a juvenile justice system concern were not well served. So there is a school to prison pipeline. Rather than just waiting for them here as an outpatient provider, why don't we go out and meet the youth where they're at? It might be at the school, it might be at client's house, it might be somewhere in the community. So that's one approach also help us to get connected with the folks that we work directly. And the other approach that we also take is not only recovery from intergenerational trauma or recovery from substance use issue, but focusing mainly in terms of positive identity formation, culturally, developmentally centered, and also causing more strong identity that also back you up in terms of considering cultural and social issues. Of course, we do use evidence-based and best practice approach, but we also consider our treatment foundation is Nguzo Saba, the 7 principle of Kwanzaa. So I want to quickly touch on that as well. These are the 7 principles of Kwanzaa. I don't know how many of you guys are aware of this. I'm going to quickly mention that these principles are the founding blocks in terms of how are we approaching youth, families, and the whole community. And Nguzo Sabas are the 7 principles in African-American culture. They were formalized to create a bridge to Africa and ancestral origin. Earlier, when I talk about everything didn't start in 1619, that forced you to connect the dot, the origin, the people of Africa prior to 1619. That gives you a lot of historical perspective to see people through the different lens and eye as well. I'm gonna go back again quickly and talk about maybe one principle, Umoja. The previous building that we were was also called the Umoja Center. It's a Swahili term. It means unity. It makes you to strive for unity with the family that you work, and a community, and a nation, and a race. So these are the 7 principles that we use in our treatment approach, in addition to the evidence-based best practice approach. Just to give you how we operationalized it in our treatment setting, every Wednesday we have a family support group, a multicultural family support group. This is a session not only for an individual, as Archie mentioned earlier. We invite all the support group for the youth. It might be his mom, his dad, or grandparent, or it might be the youth foster parent or proctor parent, whoever they identify their support group. We invite them to this multi-family cultural support group. And we had a chance in the past, even some family members, to co-facilitate these sessions and telling the ground rules about the group to other new coming family members in the whole process. And the first half of the session, we discussed the topic of the day. The last half of the session, we have food and spoken word. And that's a space as well that we share and discuss the current issue with a meal. If you see this, we have done it during the pandemic. This also gave us a good opportunity. 2021, right after the days of George Floyd, Ahmed Arbery, Breonna Taylor. So this gives us a space to process racial trauma that has been impacting youth and families and the whole community. So we were not directly addressing only substance use or mental health issue, but this gives you a space to deal other factors that most likely to cause the young man or women to use substance. Do you guys have any question around the 7 principles of Kwanzaa, how they operationalized? Okay, thank you. Then if you don't have, let's go ahead and consideration this for the healthcare providers. I hope this is pertinent to you all. Again, this is also important to consider about forming a relationship, what Archie talked about earlier. Before you ask a lot of questions, it is so important to spend time to form a relationship. It will help you to avoid misdiagnosing, underdiagnosing any young person. So it's so crucial that you spend enough time knowing the youth and family, where they're coming from, what is their cultural perspectives, having that kind of good therapeutic alliance. And this, for instance, if I gave you an example that usually we've been seeing recently, there is a high rate of drug exposure prenatally. That causes a lot of harm to young men or women or whoever that are sitting in front of you. Teachers are labeling it, these kids are causing more harm in my classroom, and I'm getting them out of a class setting. So no one asked them about this kind of developmental question. Asking deeply about how was your experience when you were a child. Sitting down with a parent as well, with the mother, and asking how was that prenatal experience? How was your health during the time of conception? Having that information will give you a lot of information to support that youth who's sitting in front of you. So it is so important for us to spend enough time forming a relationship. So at that process, it will help you to serve anyone who's coming to you in the best way that you can. The other piece I also want to touch base is providing cultural responsive case management. For instance, a young man who's impacted by gang or gun violence, they would like to come and access treatment. But they're so afraid that if they take public transportation, they will get shot at. So what kind of resource are you going to put as a provider? So that kind of a case management will help you a lot. Might be an immigrant family. They cannot speak English. So you might need to have a translation service. So identify what are those culturally responsive case management you might need to do to provide treatment in the best way and a high quality of care to the folks who are coming to you. I'm going to pass it to Archie as well. There are a couple of things he would like to talk about here too, and also give us an example. If we really want to achieve to a level of cultural competence at a higher level, it is so important institutions are also taking ownership in the whole process of forming culturally responsive treatment. So I'm going to pass it to Archie quickly on this one.
I didn't know I was coming back up. Well, good. We only got like a few minutes. One of the examples that one of the culturally specific groups that we do at Project Network with the women is called Sankofa, which is from Africa. Correct me if I'm wrong, the Yoruba tribe. The symbol is a mythical bird looking over the back, saying, know your future to know your past. And that in itself is a really important cultural piece. And, us teaching some of the African American women something about their ancestors with that Sankofa group. And we go over a lot of different curriculum. We process in there We reference Dr. Joy DeGroy Leary, who has written Post-Traumatic Slave Syndrome, which goes into that historical trauma, and she talks about how that trauma can get passed down. I learned in school how that, I didn't know this till I went to school, and they taught me that, a pregnant woman can pass that stress onto their unborn child, and the cortisol level and whatnot. And so that's important, because those ancestors in Africa, it was sent down generation, and there was no therapy involved. So you can imagine the impact on that. Also, I know at DePaul I did a rainbow group that's pretty similar, but just allowing that forum for those women, and that rainbow group was for men. So, and I was able to reach both, and I don't do either one of those groups anymore. But it's very important to have that cultural piece for the women that may been adopted by a white family and don't know their black heritage at all. And I run across that a lot. So I told Tess that he was going to do more talking than me. So I'm going to go ahead and, before I turn it to Tess, I really appreciate us having that conversation. And, we have to talk about those. We didn't really scratch the surface, but at least we're moving forward by talking about it a little bit, because there's a lot more to talk about and a lot more uncomfortable conversations to have. So thank you all for participating. I was scared at first that you guys weren't going to.
Thank you, Archie. Anyone who has a question before we proceed? And I hope this wouldn't be the last culturally responsive treatment approach that CareOregon will be hosting. And this will give us a chance to go beyond cultural competency, to go into more resistance to the system that has been oppressive in the healthcare system, where there is a medical apartheid that exists in a different form. So I hope we'll get a chance to address those kind of issues in the future. I want to quickly mention about if we want to be culturally responsive, it is so important if you are here, a manager, a program supervisor, or a head of any program, it's also good you take ownership in terms of forming culturally responsive treatment, new setting. So committing to forming that culturally responsive treatment is also requiring that kind of institutional ownership to achieve a level of high quality of care. And also, it will require a strategic planning process. For instance, if you want to increase your revenue by 10%, from the bottom to top of your institution, you make different kind of adjustment to achieve that kind of revenue increase for that fiscal year. Again, if you want to create a space for culturally corresponding, culturally responsive, culturally specific, whatever you want to increase, it also requires the same kind of a strategic planning approach. And if possible, inviting and having a board member. Likely we have an African American advisory board. They give us a guidance. That includes clients, folks with lived experience, and also staff. That guidance channel us on the right direction. When we step out, hey, they will steer us to go in the right space too. So it requires not only a staff who just graduated from college, but institutional commitment to form this kind of a comprehensive, culturally responsive treatment. I know this is the last slide. It's also very helpful to consider and think about what are some of strengths-based interview or intervention that I can do. It is so easy when we receive referral, we see a lot of negative information. So it is also good to consider what are the strengths, what are the skills that this user has. For instance, to ask them that what is their social support system, natural support social system. If this is a user who is with the DHS and a DHS custody, it is always good to tap into natural support system and surround the youth with this. So this will give you a tool to engage and work with youth with a different perspective, and also to include spiritual or faith-based approach. You all know in terms of the role church has played in the recovery community. So it is good to consider what are this youth or this family religious approach or spiritual belief. So that will give you a lot of resources and tools in your hand. This will bring us to the end of this presentation, and thank you all. And I will just create the space to you all if you have any question.
First of all, thank you. As a dark-skinned Black woman, I like to tell everybody that if me, myself, is always learning, all of y'all should also be learning continuously. And I guess the other comment that I wanted to share is just because you happen to be the only Indigenous queer therapist, it doesn't necessarily mean that you're the best therapist for whatever client is coming to you seeking those identities. So just be gentle and compassionate with yourself also.
Good point, thank you. And also, there was just related to that, there is a study that suggested folks, even African American or Black folks, who knows their history, who knows their experience, they have high self-esteem. And clinically, they draw that kind of a boundary in terms of how to approach, how to communicate this kind of information. So thank you for sharing this. All right, you all, thank you.